All right, welcome back. I hope you're having an amazing time so far. Our next speaker is Margarita Sordo. She is a senior medical informatics research scientist at Brigham and Women's Hospital, Harvard Medical School. Please join me in welcoming Margarita to our virtual stage.
Thank you so much for having me. It's a pleasure to be here today with you all to talk about explainability to increase transparency of AI applications for clinical decision making. And why is this important? Because when we think about the practice of medicine and the whole context of healthcare, we need to be aware that it requires asking questions and applying knowledge to provide the best possible care. So the physicians and all the clinical personnel, they need to find information, facts about the state of the patient, and then apply all the medical knowledge to find a solution, if you will, to find what needs to be done if they still need to gather more information. So in this context, answering a question in the form of a recommendation that comes from a decision support system, for example, for ordering a medication, a procedure, a laboratory test, is good, but it's not good enough, because there are some other factors that are very important that they need to be exposed and presented to the physician so they understand where this information is coming from, where this recommendation is coming from. And by that, I mean that it's important to know what is the clinical context, where this system is functioning, because it's very different to have a system that is functioning in, let's say, the emergency room, from a system that is being used in an outpatient setting. So it's, the needs and the urgency of the information and the decisions that need to be taken, it's quite different. So similarly, we need to know about what's the clinical state of the patient, and by this, I mean, if the patient is sick with some disease and the physician is trying to find out what's going on, it's very different to have a patient that is in a very acute state, because again, there's this urgency to find solutions to ameliorate the pain or the discomfort that the patient is going through. Whereas if it's a chronic disease, well, there's a little bit more wiggle room. There's this urgency is not present. So again, these are factors that need to be taken into consideration. Also, what other information is being used by this system that is giving us a recommendation? Is gathering information from, let's say, family history, from a past history of previous diseases, is using vital signs, some signs and symptoms. What information is being used by the system that needs to be presented as well, to the physician, so they can understand what's going on. Also, it's equally important, just having one recommendation, it's good, but what happens if there are other recommendations that might not be as good as the system is saying, but then if presented to the physician, they can evaluate these other recommendations, and they might pick another one because they know a little bit more about the state of the patient, the history of the patient. So yes, it's very important that we know the what, but also the why. So in healthcare, and the practice of medicine, we need to have explainability and transparency in all the answers and the processes and the systems that we apply in a clinical context. And these answers that I mentioned before to medical questions, like, can help physicians find this, would identify the right disease or the right medications and so on, are important, but also, well, like I said, they need to align with the clinical context where this situation, this encounter between the physician and the patient is happening. They need to consider what is the clinical state of the patient, and also present all data and information and knowledge supporting these decisions. So we can, there's, it goes with the explainability of that recommendation. It's explaining the why. And that's going to help, the physicians interacting with the system. So having this transparency and explanations is going to boost the confidence of physicians using the system, is going to increase the trust of the physicians on the answers that they are getting from the systems in terms of accuracy and appropriateness of the, could be the predictions, answers, or recommendations the system is giving. It's also important to ensure that it's accountability in the output, because, well, once we have an output, we can always go all the way back to the very beginning when we were gathering data, training the algorithm, testing the algorithm, deploying the algorithm, and then doing some after deployment evaluations, which I'm going to talk about that in a little while. But also, so it's important to have these explanations, but these explanations have to be meaningful. And by this, I mean, they need to be aligned with the cognitive processes physicians follow when they are gathering information and then applying their medical knowledge to find solutions, and to treat patients. So it could be a great explanation, but if it's not targeted to the audience and the users, well, it's gonna lose a lot of its power. So it's not gonna be that useful anymore. Also, explanations need to be timely and fit into the workflows, because, well, physicians are, very, very busy seeing patients, and, well, they have many things going on in their minds. Again, like trying to figure out what's the best treatment, what to order next, and so on. So having these explanations at the end of an encounter, or at the end of the workflow, and saying, oh, well, this is the explanation, and maybe you should have done blah, blah. That's not also helpful, because then that means they need to go back, and the point is that at the right moment, along the workflow, this not only the recommendations, but the explanations are presented, and are presented in such a way, that they are clear, specific to that particular recommendation. They are relatable. So the physicians can see, like, oh, okay, the system is using blah, 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 and that's coming from this blah, blah, blah. So they understand and they relate. It's not that they are not going to understand if the explanation is obscure, but that's going to require an extra effort, and that pretty much kills, the purpose of having a decision support system. So, and also explanations need to support the best practices, because the whole point is not having black boxes that make inexplicable decisions, and then just like magic, like getting a rabbit out of a hat. Here's your recommendation. Then you figure out what happened, inside the box. So that's not the point at all. So for this, we need to have, knowledge as foundation. Like I said at the beginning, the practice of medicine relies on knowledge. So we need to have this knowledge as a foundation that is going to guide and support, consistent strategies that could rely on a solid governance foundation, so they can support standardization of processes to gather data and knowledge, and then curate this data and knowledge, and tool development. Also to have sustainable management of dependencies between silos of data and knowledge, because data can come from different sources. So we need to have a sustainable, clear, consistent management process to handle all this. Also alignment of our data from different sources with existing standards, so we can ensure that it have the proper meaning, the structure, and validation. All this is important because we want to ensure that there is accountability in the output. Again, we have the output, but the output is only the result of several steps that happened before, that started with figuring out, identifying what's the clinical need that we want to solve with, by developing an AI application. Then we need to identify what data is relevant, and then create our data sets and train our algorithms, so we can have these applications that can deploy into a clinical setting. Another point that I want to mention is how we could integrate tools and applications, because a lot of the AI applications that we see right now are very punctual. They are good and they are fulfilling a clinical need, but they are punctual and they don't communicate with other applications. So if we have a solid foundation, based on knowledge and governance, then we can integrate these tools and applications into what I call ecosystems of applications, where, yes, each individual application is going to provide an answer and it's going to give us a recommendation, but also the output of one application can serve as input to another application. So we are augmenting the applicability of these tools, and also we are augmenting, potentially knowledge that could be discovered, and then later, in the form of new insights when we look at the outputs, and then we see how things are working, and we can incorporate that knowledge into a knowledge base, not only to enhance the existing tools, but also to use that later. And again, the whole purpose is to support best practices. So a knowledge-based foundation and approach, can help us understand, what the clinical needs and workflows are, because that's what we are trying to solve with the use of an artificial intelligence application. But we also need to have a clear understanding of all the different AI algorithms, because they are not created equal. They are all good and they are powerful and useful, but if we need to understand what the clinical need, the problem we're trying to solve, and then identify the right algorithm, to apply to that particular need. Also, we need to identify what's the relevant data, what are the different sources of data that we're going to use, what different data elements are important for the task that we want to solve, and then select them, prepare them, curate them, and then use them as input to an algorithm, and then to train it. Also we need to take into consideration that this, we need to aim at having as well-selected and diverse data set as possible to avoid any potential biases, or at least be aware that there could be potential biases that we need to communicate to the physicians and the clinical personnel, so they are aware of those. And once we train the algorithm, and deploy it, our job doesn't end there, as engineers or as a creator of that application. We still need to closely monitor the deployed tools and applications to make sure that, from a computational perspective, they are behaving in the way we expect them to behave. because the moment we put them in the real world, other variations of the data, some very particular nuances and combinations of things that we didn't consider or we didn't think about when we trained the algorithm, were included in the data set. So now we're gonna get something that is more richer and more complex, and we need to make sure that from a computational perspective, the tool is behaving in the way we expect to behave. Another important aspect is to reevaluate, and have a close look at performance of the tools, but from the clinical perspective. By getting feedback from users, we can make sure that the tool integrates seamlessly in the clinical workflows, and the tool is providing the right information at the right time with the right explanation, supporting these cognitive processes that I mentioned at the beginning. So for this, now I'm gonna put everything together, because, well, you might be wondering, okay, well, this is just fine, but then how do you put everything together into an application? And for that, I'm going to show how to apply this explainability and transparency concepts, for clinical decision making in the context of breast cancer diagnosis. So for this, like I said, we're gonna have, as a foundation of the backbone is going to be knowledge, a clinical knowledge of what it takes to perform a breast cancer diagnosis. We're gonna use also neural networks, but for some part of it, of the tool, the whole application, and symbolic reasoning. So we start with a clinical guideline for breast cancer diagnosis, which is going to guide the clinical decision-making workflow. These clinical guidelines already exist, and they are widely used. They are mostly in paper, but then they could be computerized. And by that, we use a tool, a platform that allows us to computerize clinical decision support guidelines. So it kind of gathers all the concept, the decisions, the actions, and then puts them together. And then these guidelines are executable in a computer. And here we're going to, the process translates all the actions and so on into tasks, very simple tasks. And I think that the strength of this approach lies in its simplicity, because it aligns with the cognitive processes what we all follow, but specifically physicians follow, and then translates these tasks into it could be actions, like these square box here. It could be what we call inquiries, which is basically gathering or fetching data and information and facts from different sources that then is going to use to make assessments or decisions. So by having this the clinical guideline as a backbone, then we can integrate sources of medical data and knowledge that come from different repositories. In this case, we have the electronic health record to gather information about the patient history, past complaints, previous diagnoses, medications, and so on, whatever is relevant. And also we have, it's another source, we have mammograms. So instead of feeding mammogram, the whole mammogram into a deeper learning algorithm, which is what probably a lot of people would do, what we do is we perform the image processing and identify potential abnormalities. In the same way, remember that we are aligning the whole workflow and actions and so on with a cognitive processes that physicians follow. So when the physicians look at the mammogram, they identify potential abnormalities. So we do the same by processing the image and identifying those potential abnormalities. And then what they do, they're going to characterize these potential abnormalities in terms of different features, because they look at those abnormalities and they're gonna determine what's the size, what's the shape, what's the density, what's the location. That's what they do. So this is real world actions. So instead of having a 3.4 that comes out from the image processing algorithms, which if that corresponds to the size of the abnormality, that doesn't really say much. Oh yes, of course, a physician could think about a 3.4 and determine, well, the size is such and such. But then again, that is not aligning with their thinking. So what we do is we get these abnormalities, we characterize them in terms of size, because that's what they got. So they determine if it is, for example, small, medium, large. Shape, if it's round, elongated, with tiny peaks. The density, if it's low density, medium density, high density, or something that is very dense, and the location of the abnormality within the breast. And obviously, what we can see that here, knowledge is guiding, the whole process, and it's preserving the meaning. So we are simply using neural networks to as translators, if you will, some a particular an algorithm to map, something that is numeric into a symbolic representation that then is going to be consumed by the clinical guideline that is running behind, in addition with data that is coming from the patient record. Also here, I want to mention that the way we're going to get an answer, from the assessment is behind the scenes. In here, we not only have the executable guideline running and managing the workflow, but there's also, when it comes to assessments or making decisions, there's the engine runs or executes a reasoning by argumentation, and by that I mean it's going to take all available facts that are being presented in terms of what the clinical history of the patient that comes from the patient record, and the results of analyzing the mammogram and these characteristics that were identified for each potential abnormality, and it's going to give a recommendation, but it's also going to present facts that are going to be supporting each potential recommendation, and also facts that are against each potential recommendation. So with this approach, we are fulfilling what I mentioned at the beginning, that we should get not only recommendations, but also explanations that are relatable, and also and present supporting evidence in such a way that that all these process aligns with the cognitive processes physicians follow. So what we have here is that with this approach, we have the segmentation of the image, and then classification of the in terms of characteristics, with the recommendations and explanations that are going to come out of the system. So in this case, specifically, we have that for this particular abnormality, the assessment, which is, this is the recommendation, we have, it's saying that it's benign, and we are getting the supporting evidence, you know, in terms of those characteristics that are important and that physicians use when they identify these abnormalities in a mammogram. So the system is telling us that this abnormality is benign, most likely, because of the size is small, you know, the shape is round, the density is low, and the location is mid-breast. And so, like I said, we can see that, you know, this assessment is benign, and the supporting evidence is, you know, in terms of meaningful facts that relate to the way physicians think about, you know, when they are looking at the mammogram. So we get that, you know, the size is small, the shape is round, the density is low, and the location is mid-breast. So overall, we are integrating different AI applications together into one. We are supporting everything on knowledge from the problem we are trying to solve, and we are providing not only recommendations but explanations that have a meaning, and, you know, everything in the context of having, you know, transparency to support best practices. Thank you so much.
Wow, thank you so much. That was awesome. If you can stop sharing your screen, I know this virtual crowd is going wild with us. That was amazing. Thank you for taking time to share with us today.
Thank you. Thank you.
Yes. For the audience, it's time for you to make your way to your next session. Along the way, make sure you accept your connection request and take some time to check out our amazing exhibits. Thanks so much, and we'll see you around.